3 as a pair, so that I have 2 usable gloves. Next, let's start with airway. So I want to have a couple airway things. So I have some lube and a nasopharyngeal airway that is adjustable. So instead of having 10 sizes, bring one that we can adjust. Then I have a face mask as well. Like, you don't need to bag valve mask a patient, right? You can do mouth to mouth, that works well. In the COVID era, something we've shied away from, but if you have a hypoxic arrest, like CPR, hands only CPR isn't gonna do it, right? They need to breathe. So a face shield is part of this. Then we'll start to just go with whatever I pull out, because otherwise...
So does that just have a little one-way valve or what?
This one doesn't have a one-way valve. Some do, but the one-way valve is kind of bulky.
Yeah.
I use those in most of my kits,
Yeah.
but this isn't a first aid kit, and the primary objective for this is it to be small. So instead, this has kind of layers of like gauze type thing, so that vomit would hit it and be redirected. And if you had, it would take a while for it to soak through the layers, right? So if you didn't notice vomit for that long, then you're really not paying attention. So yes, yeah. But for a good point, I wouldn't have space for much more. So. I bought some waterproof paper, and I took out the staples. And I don't need the whole book. I just need 2 pages, so I brought that. I'll show you some wound closure stuff. I'll in a second we'll take out some alcohol swabs, and we can look at the difference between them. But I have a bag for garbage. I have iodine in case someone has. In case I want to do a procedure and I have already used my alcohol swabs. 2 alcohol swabs that are small, multi-purpose, and then 1 big one that I can use once I've used up my hand sanitizer, or these that I can use kind of for either. So my thought process is to start using up the things that are only single use, and then keep the multi-use thing at the end, which simplifies life a bit. I have a small ABD pad for bleeding, and then I have, you'll see a couple different sizes of sponges. I have some duct tape, again that's paper backed, makes it packing it easier. This, I actually made this one. I had like a long piece of, I can't remember, I bought something and I was like, this is awesome. It's like this long piece, and just put a piece of duct tape, cut off the ends, and I rolled it up and put it in. As I said, I like to have a couple different options for tapes. So we have duct tape, KT tape, some athletic tape, and in the center of my athletic tape I keep a dental floss, and in the center of the dental floss I keep the metal part that comes on the dental floss container, in case in case shit really hits the fan and I lose my sharp things. Speaking of sharp things, I have my trauma shears. These things are actually strong. You can cut through a penny with them. So reasonable tool. I want some writing utensils, so this is my extendable pen, and I have a Sharpie as well.
Yes.
Yeah, absolutely. So I'll get that out of here in a second when I find it. I have a set of hemostat, just a curved, tiny hemostat. That has a couple purposes. If I want to suture something, I need to, God forbid, do a crike with my nasopharyngeal airway or something. For bleeding, I also have some Celox. So Celox is a hemostatic agent that you can put in the wound. It's a powder. There's a bunch of different types of hemostatic agents. This is a really, there's better ones. You want impregnated sponges. They're preferred. And some of them are activated, so they work even on people who are on oral anticoagulants. They causing the blood to still clot in seconds. Those are really good for bringing people with, have AFib or for whatever reason are on oral anticoagulants. They're very expensive. They're about $40 for one. It's Celox. One is Celox. One is Quick Clot. There's a couple of different ones, but they'll usually have the word active on the end, indicating that they have an agent that accelerates the clotting, not just maintains stasis once it occurs. So this is less expensive. This is about $1.50 or something like that, $3. We have some burn gel, so some lidocaine gel for burns or for procedures with pediatrics. You obviously need some time for that. Other procedure stuff, I have a sterile needle that I can either use for delivery of drugs if someone has a syringe or irrigation to help. I like to have a smaller tip to really get that high pressure. Or for draining, a big blister, I'd go through the healthy skin, like clean the healthy skin, go up without puncturing the blister, and that means that you have a barrier with your immune system to prevent infection from going into where there's a lot of dead material. So you can drain it. Eventually it will de-roof, but it gives you a little bit of time before that happens potentially. My indicator that it's a medical kit, and it's 589 milliliters. Here's my fluorescein strip, and I have a blue filter for my headlamp in here as well.
Okay, so that's you filter it through the headlamp.
You filter it through the headlamp, exactly. Here are some more. This is 2 pieces of the smaller KT tape and some cohesive dressing. I usually pack a couple Band-Aids. My preference is to pack Spider-Man and Smiley Face ones, and adults seem to like it just as much, or perhaps more. And you can also get, they make silver impregnated Band-Aids. They're a little bit more expensive, but again, if you're going to be wearing them for longer and trying to get more out of a very small component, then that's great. Here's some more gauze to go with the bleeding. I want to be able to close a wound, and we can pack the wound, but we can also close. I really like the wound closure with steri strips, which don't stick to anything. But if you add, these come in different containers. This is tincture benzoin. Tincture benzoin comes in some big swabs too that are super messy and a pain. Basically, this is sap from a tree that's diluted in alcohol. You apply it to the skin, and then the alcohol evaporates, and the sap is left. And so you apply it on either side of the wound. It's sterile. You break the vial that's in the applicator. You apply it on both sides of the wound after you've cleaned the wound. You use the steri strips to close it, and now the steri strips actually stay. And then you put the Tegaderm, being clear and waterproof. You can be doing your water-based activity. You can see if it becomes infected. It will stay on a couple days. This is one of my preferred methods for wound closure of superficial injuries for a variety of reasons. But if I need a backup, another backup is Crazy Glue. Originally designed for tissue closure, and we only learned that there might be some toxicity of it later. And mostly, I think they just wanted new patents. It will burn. It will be uncomfortable if it is on open tissue. But if you close the tissue and approximate the edges and don't get your finger stuck in there, it works pretty well. I bring a sting relief pad. I do usually when I go hiking with my kids. I actually bring a bigger kit than this. So. But in case, it's a personal kit, so on trips where there's going to be a bigger group kit, I still have some options. We'll finish some of the bleeding stuff first, I guess, and then we'll move on to the pharmacy here. There's my marker, a tampon both for bleeding and also for most commonly used when people forget a tampon but can be used for a nosebleed, can be used to pack a penetrating wound, kind of a useful thing. Litmus paper, more just for when there's a chemical exposure and you're trying to figure out is this, what was it? Is it acid or base? Doesn't take up very much space, and sometimes we do a lot of science experiments with it. So, some zip ties. So zip ties, you got to be careful with putting it around something, a person. But if you're trying to make a splint and everything is too short, there's a couple of uses of them. But these ones are really nice because these are they're actually reusable. You can release the zip tie component, and they make that a lot safer to use around. If you have like a really bleeding finger, you can just like tourniquet the finger and then release it after, or preferably gauze and tighten it, and then you don't have to hold it. But they're a couple uses of this, partly for gear repair too, right? But certainly the releasable kind. They have to be adequately strong. You don't want really tiny ones; they'll just break. I don't often use a thermometer, but on a trip, being able to detect an infection and usually you can tell clinically, and I find that non-invasive forms of temperature measurement are frequently wrong. So particularly the ones we use in hospital drives me crazy. These temporal things are garbage. But an oral one or any cavity that you can fit it in and get it out successfully. It's called, if you haven't seen these before, it's these dots have different evaporation points, and so as it will be once it's exposed to air, it will evaporate at a different boiling point, and then it will tell you the temperature. So it's kind of like a chemical single-use device.
How durable are they? Because
Yeah, it's
I have
paper.
one and they just
It can fall apart. Yeah.
they just are no good anymore.
Yeah, this I've been able to keep it in roughly good shape. This is the same one that's been in there for a couple years now.
Okay.
This is two chlorine dioxide tablets for treatment of water. If I need to treat 600 mils of water, I can treat it twice with this, and because it's designed for a liter, I could actually probably treat cryptosporidium in this container. This is a little splinter out thing. It's a sterile piece of metal that has a triangle, and I find it's a lot easier than tweezers to get splinters out, or to deal with really small cutaneous problems. This is a set of titanium tweezers that are small enough to deal with ticks or things like that. This is my big safety pin. That's my go-to. You can get bigger ones, but and then I have a couple other ones here as backup, as well as a needle for sewing with my dental floss. And then the container could also be used for storing the tick when you pull it out. This is a scalpel, in case I have to do surgery with this kit. That's a joke, but these are two non-adherent sponges. So if you have a wound that you think that's going to be really painful to take off after, then got that. This is the big wipe I told you about. Here's my filter for my eye exam kit.
So what kind of filter is that? Like it's just annual blue filter?
I just bought a blue acetate filter,
Okay.
and then I checked it with my headlamp to make sure that it would work with and it fluoresced. It's supposed to be cobalt blue.
Yeah, like specific frequency.
Specifically, and you can buy adapters for some headlamps, and I have for some of them are big or for flashlights, so you can buy adapters, and I have adapters as well, but they don't fit into this kit. So if I'm planning a trip, an expedition, I would bring something dedicated. I have dedicated equipment for ENT that also has a cobalt filter on it, and I also have a headlamp that has a blue LED as one of the lights on it, which is useful at night because it shows blood. and doesn't destroy your night vision. So instead of a red, it has a blue. So it does travel a little bit farther, but I'm not engaged in any military activities. It's just to keep my night vision. And then because it's only using one frequency, I still have my other cones, I guess, for vision, and they're left unaffected. But I can see blood because blood turns black in that blue light compared to red. Everything is red, and you can't see it.
They talk about using just a blue Sharpie over some clear plastic, and then you can put that over your light source.
You could try. Does it work?
Ian Rapp says that.
That works. Oh, awesome.
Just put a blue Sharpie.
Yeah. So now we'll get on to the pharmacy part. So I have some pre-packaged stuff. So here's hydrocortisone cream, ibuprofen, loperamide. These are some powders, so that they don't have to even be chewed. This is aspirin that you can just like basically swallow the 325 milligrams of aspirin powder. And this is diphenhydramine. Something I didn't talk about, I forgot to, is that gravel, dimenhydrinate, and diphenhydramine. What's the difference between diphenhydramine and dimenhydrinate?
One functional group.
What?
One functional group or something.
So what it is it turns out that gravel, which many people use for sleep aid, you shouldn't use. It's actually exactly the same, except that it has a 8-chlorotheophylline added as a stimulant. So it's actually a compound drug that includes a stimulant and diphenhydramine. So if you want, instead of bringing two drugs, gravel and Benadryl, you're actually bringing one drug with and without a stimulant. That's how I think about it. The dose is different because it's 50 milligrams of the combination instead of 50 milligrams of the solo drug. But I don't bring gravel anymore in small kits often because I can just bring more of one and cut costs and have a higher dose of the drug. So this will open the rest of the pharmacy here, and then I'll have to start putting it away.
But when they're nauseated, you tell them that the Benadryl's gravel.
Yeah, exactly.
Yeah.
Otherwise,
They won't know.
They won't think that they're
Yeah,
getting
exactly.
Not itchy
So-
anymore, but I'm really not.
Yeah. So speaking of nausea, I have actually lots of options for nausea in this kit. So,
So would you do like
So-
ODT Zofran just because it's yeah,
Right
you got
there.
it there.
so this is an oral dissolving film as opposed to the tablet. So it's just
Okay.
it's flat. It fits in really well. Then gravel, ondansetron is actually less good for motion sickness than ginger. So I bring ginger, this is a personal kit, not a first aid kit. I bring it for if I end up in a helicopter or something and I'm worried that I'm going to be providing care and I haven't been in that environment, I'm going to have a higher chance of having motion sickness. Then I have something for myself for that purpose, or it can be used for other people. So there's like several options here already for nausea. We have a little bit of bismuth salicylate. I actually do have some more diphenhydramine there in case we have more severe allergic reaction. I have 2 tabs of doxycycline. I have some paracetamol or some acetaminophen Sudafed. Just some straight Tylenol. Some more ASA. I have a little packet of to absorb moisture. I have dexamethasone. And I have some Tylenol 3s for those people who are able to metabolize codeine, something a little bit stronger. So and you can and sometimes in the past I'll put in hydromorphone. The tabs are tiny, right? So they're able to be fit into this pretty full kit. So this is what you can fit into a tiny kit when you're thinking about the size as the primary objective and thinking about things that have multiple use, how to pack it. Certainly, some things to think about. Medications don't last as long in these kinds of containers. That's a whole other topic, but you would want to it works better because it's in this. This is what makes this okay to some extent. It reduces the movement of basically nitrogen into the bags and CO2. So, anyways,
Practically speaking, are you just, because I don't know the expiry dates or whatever shelf life on any of the meds because they're all repackaged, are you just replacing those every year?
so yeah, I replace them every year, and this is actually my demo kit. But you'll see in my medication, my like little pharmacy there, that I put the expiry dates on. I just put the expiry dates on the package, and then if I give it to someone for them to I'm like, you're having pain, here, you take this, or you're having diarrhea, I'm gonna give you this pouch. This is a day's supply. Come back to me tomorrow if you haven't used all of it. Tell them how often to take it, and then if they end up with it in their bag and I forget about it, they have an expiry date on it.
How do you get medications?
Sorry.
Like where do you get?
Yeah, that's a good question. I have 4 pharmacies, 2 in Alberta, 1 in Thunder Bay, 1 in Montreal, that I have arrangements with where I basically write myself a prescription for an event, and I transfer stock from the pharmacy to me so that it is not prescribed to me. It's prescribed to a clinic. So I prescribe it to Clinic Wilderness MD, and then they basically transfer it to me, and I've had no problems. You really want to establish, I'm going to this place all the time, because you want to have the relationship of bringing back all the hydromorphone or the ketamine or whatever, and them getting vials that are expired back, and that builds the trust, and so that when you ask for something that they would not necessarily give any physician, that you have that social capital to utilize.
And then I don't have a company like you, but for Ski Patrol,
Yeah.
we know the pharmacists, and then we
Yeah.
exactly how they're.
But do you just
Yeah.
prescribe it to your
Do you
own name?
like Red Mountain or
Yeah.
Whitewater Mountain or
Yeah, like Mount Cain, but I'm
Yeah.
writing
Yeah,
a prescription or something.
Yeah. So you can either do it your clinic, or you can do it in that too. So Minotaur Sky Race is the one I wrote for some ketamine in case we had to do some field intubations or care, and that was not a problem.
Didn't have to do anything?
No.
Same.
You're absolutely able to take a photo. That's one part of why I put it on there.
Okay.
Yeah.